talk about taking a blood pressure on your patient when they're coming into that dental appointment. Some doctors are having offices and staff members do this at every appointment. Sometimes this is just during an extraction appointment. There's some states that require this at every appointment. So follow your regulations and your policies within your state. But let's make sure that if we are taking a blood pressure, that we're going to get the most accurate blood pressure possible. So what are some things we need to remember? When we seat our patient in the dental chair, we don't want to just rush to get the blood pressure, right? They're probably nervous. We always hear, sorry, I don't like you. I just don't like coming here. Then we need to give the patient a minute or two or three to just sit in the chair and settle, ask about the weather or the Christmas cookie recipe. So give them a few minutes. Either if their feet are on the ground, that's great. They could be sitting sideways on the dental chair. If their feet are up on the dental chair, we do want to make sure that their ankles are not crossed. If you're using a manual blood pressure cuff, old school way, and I recommend if you don't know how to take this to maybe practice and learn how in case your digital is not working correctly, or let's be honest, it needs batteries. We don't have any. We really need to make sure that we have the correct size cuff. If you do not have the correct size cuff, too big or too small, then you're also going to get an inaccurate reading. If we're using the digital, we also need to make sure that it's on the inside of the wrist as such. So removing watches and bracelets, things like that. We want to have the patient not speaking during the blood pressure cuff reading. Some of these digital monitors require that our arm goes over the chest, or at least that the elbow is resting on the armrest of the chair. And as you can see in this diagram, that our wrist is parallel with the heart to make sure that we get the most accurate blood pressure reading as possible. Make sure you're documenting those blood pressures in your patient notes. If you have to take multiple blood pressures due to it being a high reading, then you also want to document that you had to take those multiple blood pressures as well, and also a sort of timestamp of the appointment as well. So let me know if you have any questions, if you also have any tips and tricks, or maybe what videos you'd like to see to help you out.